Καλησπέρα σας. Την αναγόρευση του καθηγητή κυρίου Στέφεν Πόρτερ σε επίτιμο διδάκτορα του Τμήματος Οδοντιατρικής της Σχολής Επιστημών Υγείας θα προσφωνήσει ο Αντιπρίτανης Έρευνας και Καινοτομίας του Εθνικού και Καποδιστριακού Πανεπιστημίου Αθηνών, καθηγητής Ευστάθιος Ευσταθόπουλος.
Αξιότιμε κύριε Αντιπρίτανη, αξιότιμε κύριε Πρόεδρε της Οδοντιατρικής Σχολής, αξιότιμε καθηγητά Προφέσορ Πόρτα, αξιότιμες και αξιότιμοι κυρίες και κύριοι συνάδελφοι, εκλεκτοί προσκεκλημένοι, κυρίες και κύριοι, εδώ και πάρα πολλά χρόνια κοντεύει 200. Το Εθνικό και Καποδιστριακό Πανεπιστήμιο Αθηνών βρίσκεται σταθερά στην κορυφή των ελληνικών πανεπιστημίων και βέβαια ανάμεσα στα καλύτερα ολόκληρου του κόσμου. Ειδικότερα η Οδοντιατρική Σχολή αποτελεί μια από τις ιστορικότερες και καλύτερες σχολές της χώρας, όχι βάσει υποκειμενικών κριτηρίων, αλλά βάσει των πλέον αξιόπιστων διεθνών κατατάξεων και αξιολογήσεων των πανεπιστημίων παγκοσμίως. Την πιο πρόσφατη διάκριση για τη σχολή επιφύλασε η δημοσίευση των αποτελεσμάτων της παγκόσμιας κατάταξης των πανεπιστημίων του οργανισμού QS για το 2024. Σύμφωνα με τα αποτελέσματα αυτής της κατάταξης, η Οδοντιατρική Σχολή του Πανεπιστημίου μας κατατάσσεται στις πρώτες 100 θέσεις των καλύτερων οδοντιατρικών σχολών στον κόσμο. Και βέβαια από το 2017 και μετά που έτσι έχουμε μια πιο στενή παρακολούθηση των κατατάξεων αυτών, αρκετές φορές η Οδοντιατρική Σχολή έχει πετύχει πάρα πολύ ψηλές θέσεις και έχει βρεθεί τουλάχιστον 4 φορές στο top 100 των οδοντιατρικών σχολών των πανεπιστημίων σε μια από τις πιο γνωστές κατατάξεις, αυτή τη λεγόμενη κατάταξη Σαγκάης. Επιπλέον, η διοίκηση του Πανεπιστημίου και οι Βρετανικές Αρχές, σε συνεργασία με την διοίκηση της Οδοντιατρικής Σχολής, δουλέψαμε πάρα πολύ σκληρά και ξεπεράσαμε γραφειοκρατικά εμπόδια και καθυστερήσεις και είμαστε πλέον στην ευχάριστη θέση να ανακοινώσουμε τη θεμελίωση του νέου κτηρίου της Οδοντιατρικής Σχολής, το οποίο στην τελική του μορφή θα έχει συνολικά περίπου 2.000 τετραγωνικά και το οποίο αναμένεται η ολοκλήρωση της ανέγερσής του περίπου σε ένα χρόνο από τώρα, περίπου στο τέλος του 2025. Και στόχος μας είναι μέσα από αυτό το σημαντικό έργο να υποστηρίξουμε το εκπαιδευτικό, το ερευνητικό, το επιστημονικό έργο της σχολής και να βελτιώσουμε το ήδη ποιοτικό περιβάλλον της σχολής για τους καθηγητές, για τους φοιτητές μας, για τους συνεργάτες μας, εφάμιλο με τα διεθνή πανεπιστημιακά πρότυπα. Τώρα σήμερα εδώ βρισκόμαστε για να απονείμουμε έναν τίτλο, τον τίτλο του επίτιμου διδάκτορα της Οδοντιατρικής Σχολής σε μια από τις σημαντικότερες προσωπικότητες στον χώρο της παγκόσμιας στοματολογίας, τον καθηγητή Στέφεν Πόρτερ, καθηγητή του UCL Eastman Dental Institute της Αγγλίας. Ο καθηγητής Πόρτερ είναι διεθνώς αναγνωρισμένος για την κατάρτιση και τις πολύπλευρες γνώσεις του στον τομέα της στοματολογίας και έχει αναδείξει τον λόγο γνωστικό αντικείμενο τόσο μέσα από το πολύ σημαντικό ερευνητικό του έργο, με πολλές δημοσιεύσεις και πάρα πολλές αναφορές, όσο και μέσα από σημαντικές διακρίσεις που έχει λάβει στην διάρκεια της καριέρας του. Η συνεισφορά του κ. Πόρτερ στην διδασκαλία και στην έρευνα, καθώς και η σημαντική και άοκνη κοινωνική του δράση, ιδίως μέσα από την πολύχρονη παρουσία του ως πανεπιστημιακού δασκάλου στο Eastman Dental Institute for Oral Healthcare Sciences, τον καθιστούν μια από τις επιδραστικότερες φυσιογνωμίες στον επιστημονικό κλάδο της στοματολογίας. Τον καλωσορίζουμε λοιπόν στην Οδοντιατρική Σχολή του Πανεπιστημίου Αθηνών. Dear Professor Porter, we welcome you to our university community and we are looking forward to our future collaboration. On behalf of the University of Athens, I would like to express to you my warmest congratulations. Welcome to our community. Thank you very much.
Παρουσίαση του έργου και της προσωπικότητας του τιμωμένου από τον καθηγητή Νικόλαο Νικητάκη, πρόεδρο του Τμήματος Οδοντιατρικής.
Αξιότιμοι κύριοι Αντιπριτάνης, αξιότιμοι κύριοι καθηγητές, αξιότιμοι κύριοι συνάδελφοι, αγαπητοί φίλοι, είναι πραγματικά ιδιαίτερη τιμή για μένα να βρίσκομαι σε αυτό το βήμα και να συμμετέχω, όπως όλοι μας, σε μια ιδιαίτερη στιγμή για το Πανεπιστήμιό μας, για το Τμήμα Οδοντιατρικής και για όλους όσους ασχολούμαστε με τη στοματολογία και την οδοντιατρική στη χώρα μας, καθώς, όπως προανέφερε ο αντιπρίτανης καθηγητής κ. Ευσταθόπουλος, ο καθηγητής Πόρτερ αποτελεί έναν από τους πιο σημαντικούς επιστήμονες, ακαδημαϊκούς και κλινικούς στον χώρο της στοματολογίας και της οδοντιατρικής γενικότερα. Θα συνεχίσω στα αγγλικά. Dear Professor Porter, it is a great honor for all of us. It's a unique privilege for me to welcome you to the National Kapodistrian University of Athens on this very special occasion, on the day that you will receive one of the greatest honors of our university, the honorary doctorate degree, but it is indeed our honor to have you here joining our ranks. I would like to present briefly the very extensive, very impressive and inspirational CV of Professor Porter. Professor Porter is Professor of Oral Medicine of UCL Eastman Dental Institute in London. He held the position of director of this institute between 2008 and 2024 for 16 years, and hence he's the longest-serving director dean of any dental institute in the UK and possibly in Europe. He holds degrees in biochemistry, dentistry, medicine, as well as PhD in immunology and Doctor of Medicine by research. He's a fellow by examination in dental surgery of both the Royal College of Surgeons of England and Edinburgh, and actually Scotland is his place of origin, and was awarded an honorary fellowship in dental surgery by the Royal College of Surgeons of Ireland as well. He is past president of the British and Irish Society for Oral Medicine, also past president of the European Association of Oral Medicine. He is a past senior vice dean of the Faculty of Dental Surgery of the Royal College of Surgeons of England. He was a contributor to the first World Workshop in Oral Medicine, a very important foundation in the field of oral medicine. And considering his young age at that time, is possibly the only reviewer of that meeting to be still academically active. So he's the living history of our specialty. He has been awarded many awards. I will just mention a few. The John Hunter Medal for Biochemistry from the University of Glasgow, the Menzies Campbell Medal of the Royal College of Surgeons of England, the Edward Leo Sheridan Medal of the Royal College of Surgeons of Ireland, as well as an honorary Doctor of Medicine by the University of Gothenburg in Sweden. His research interests are extensive, but has mainly focused on contemporary aspects of oral medicine and allied areas, having encompassed various fields of research, such as HIV disease. He was one of the very first to study HIV disease, and especially its oral manifestations, as well as other immunodeficiencies, the herpes group infection, the mycotic infections, the potentially malignant oral mucosal diseases, and the salivary gland diseases, among others. He has published over 500 scientific papers, and at present is included into the top 2% of most cited authors in the field of dentistry worldwide. His research findings have included the oral phenotype of HIV disease, the frequency of oral carriage of human herpes virus 8 in immunodeficient individuals, the frequency and nature of azole resistance of candidal species in HIV disease, risk factors of oral epithelial dysplasia, the identification and non-invasive diagnosis of potentially malignant oral diseases, as well as the management and the malignant potential of oral lichen planus. He has co-authored several books, more than 12, authored many invited chapters for major texts, not only for oral medicine, but in other related disciplines such as otorhinolaryngology, gastroenterology, oral maxillofacial surgery, dermatology, and many other articles for clinicians as well as for patients. His clinical interests include the medical management of disorders of the oral mucosa, salivary glands, and abnormalities of orofacial sensation. He has a particular focus upon the management of complex diseases, and for that reason, he is well-renowned and receives referrals from specialists of many fields in London, the surrounding areas, from Greece, from other European countries, and from all over the world. His present clinical interests include the impact of IgG4-related disease upon the mouth, as well as the evolution of disease of the salivary glands and other tissues by state-of-the-art therapies, such as immune checkpoint inhibitors and proton beam therapy. Actually, I see here in the audience our residents, and we were all so lucky to have Professor Porter this morning presenting us some exciting cases and highlighting areas such as checkpoint inhibitors and their side effects and manifestations from the oral mucosa, proton beam therapy, and other state-of-the-art technologies and advancements in the field of oral medicine. His clinical work is combined with the postgraduate teaching of students from around the globe, having established master's programs in both oral medicine and special care dentistry, and actually these remain the only such programs in the UK. He has a long track record in successful PhD supervision, with postgraduates going on to hold now senior positions, faculty positions in universities across the globe. Please allow me to say that we have here the Dean of the School of Dentistry of the University of Thessaloniki, the Aristotle University of Thessaloniki, and I think he's very proud to have studied next to Professor Porter, as well to late Professor Scully, and then, of course, moving on to be the current Dean of the School of Dentistry and Chair of the Department of Oral Medicine and Pathology in Thessaloniki. Professor Porter has a strong interest in the transfer of knowledge of patients, and as such is the clinical advisor to several patients groups in the UK and internationally, such as the British Sjogren's Syndrome Association, the Raynaud and Scleroderma Association, the Lupus UK Association, the Ehlers-Danlos Syndrome Patient Group, and the Epidermolysis bullosa Group. When he was presenting his lecture this morning, he made a comment that our aim is to provide to our patient the best care, but also listen to the needs of the patient. Because if the patient's goal is, let's say, to have a last enjoyable meal, if his survival is limited, then our aim should be to fulfill our patient's dream. And I think that was very inspirational. His leadership of UCL Dental Institute has been marked by the redevelopment of completely new clinical and research facilities. Actually, that opened in 2020, and during that time, there was the establishment of the United Kingdom's only oral theme in a biomedical research center of the National Institute for Health Research, and the award of Athena Swan Silver by the Quality Charter of the UK, reflecting both his leadership and commitment to equality, diversity, and inclusion within academia. On a personal note, Professor Porter, who actually with the late Professor Scully constitute a duo that has been an inspiration to all of us. Professor Porter has been always so supportive to all the activities of the Hellenic Association of Oral Medicine and the predecessors of this organization. He has visited Greece many times and has shared his knowledge, experience, wisdom with all of us. Allow me to say that he has very strong ties with Greece. Some of them are professional, some of them are personal and family related, since his beloved wife is Greek. And therefore, he's spending a lot of time in our country and has honored us with his friendship and support throughout the years. Professor Stephen Porter, dear Stephen, I'm really honored and moved to be here today and welcome you to the ranks of the distinguished ranks of the very few recipients of the honorary doctorate degree of the National Kapodistrian University of Athens in the field of dentistry. Thank you very much.
Αναγόρευση του τιμωμένου. Ανάγνωση των κειμένων του ψηφίσματος του Τμήματος της Αναγόρευσης και του Διδακτορικού Διπλώματος από τον Πρόεδρο του Τμήματος Οδοντιατρικής Νικόλαο Νικητάκη.
This is an official part of the ceremony, Professor Porter, so I will continue in Greek, and actually this is old, almost ancient Greek, just to show the gravity of today's ceremony. Εθνικών και Καποδιστριακών Πανεπιστήμιων Αθηνών. Ψήφισμα του Τμήματος Οδοντιατρικής των Επιστημών της Υγείας Σχολής. Τύχη αγαθή, πριτανεύοντος εν το Αθήνησιν Εθνικό και Καποδιστριακό Πανεπιστημίο, Γερασίμου Δέλτα Σιάσου, κοσμητεύοντος εν των επιστημών της Υγείας Σχολής Εμμανουήλ Α. Πικουλή και προεδρεύοντος εν το της Οδοντιατρικής Τμήματι Νικολάου Γ. Νικητάκη, έδοξεν ομοφόνος το τμήματι Στέφεν Πόρτερ, τα του ασκληπιού έργα μέγιστα επιστάμενων, την οδοντιατρικήν επιστήμην έργο τε και συγκράμαση προαγαγόντα και την εαυτού φιλανθρωπίαν πολλαχή επιδειξάμενων, προς δε τούτης εύνουν της έλυση διατελούντα, επενέσετε αυτόν και του της οδοντιατρικής τμήματος, διδάκτορα επίτιμον αναδείξε, το δε ψήφισμα τόδε εις μευράναν αναγράψε και τον του τμήματος πρόεδρον δημοσία εν τη αιθούση τη μεγάλη αναγνώντα και τα στιμάς ανυπώντα, επιδούνε αυτό ή αν η μέρα η αναγόρευσης γέννηται καθά νενόμιστε. Εγένετο, Αθήνηση, μηνός Μαρτίου, 7η και 20η, έτους 4ου και 20ου και της χιλιοστού από Χριστού γεννήσεως. Ο πρόεδρος του Τμήματος Οδοντιατρικής, Νικόλαος Γεωργίου Νικητάκης. Αναγόρευσης. Επιδίπερ το Τμήμα Οδοντιατρικής της των Επιστημών της Υγείας Σχολής του Αθήνησιν Εθνικού και Καποδιστριακού Πανεπιστημίου. Στέφεν Πόρτερ, άξιον απέφυνε του επιτίμου διδακτορικού αξιώματος, ιδέτης των επιστημών της Υγείας Σχολής τούτο απεδεξάτο και ο πρίτανης της σχολής γνώμη επινεύει, διατάφτα εγώ, Νικόλαος Γεωργίου Νικητάκης, καθηγητής της στοματολογίας, νυν δε του τμήματος οδοντιατρικής πρόεδρος, χρώμενος τη δυνάμει ειν παρά των πανεπιστημιακών νόμων και του τμήματος έχω λαβών, Στέφεν Πόρτερ, επίτιμον διδάκτορα του τμήματος οδοντιατρικής της των επιστημών της Υγείας Σχολής του Αθήνησιν Εθνικού και Καποδιστριακού Πανεπιστημίου, δημοσία αναγορεύω και πάσα σ' αυτό τας προνομίας, τας το πανεπιστημιακό τούτο αξιώματι παρεπομένας απονέμω. Εγένετο, Αθήνηση, μηνός Νοεμβρίου 1η, έτους τετάρτου και 20ου και δυσχιλιοστού από Χριστού γεννήσεως. Ο πρόεδρος του Τμήματος Οδοντιατρικής, Νικόλαος Γεωργίου Νικητάκης. Ελληνική Δημοκρατία. Πριτανεύοντος εν το Αθήνησιν Εθνικό και Καποδιστριακό Πανεπιστήμιο Γερασίμου Δέλτα Σιάσου, καθηγητού της καρδιολογίας, μοριακής καρδιολογίας εν τη των επιστημών της Υγείας Σχολή, κοσμητευούσης εν τη των επιστημών της Υγείας Σχολή Παγώνας Δέλτα Λάγιο, καθηγήτριας της Υγιεινής Επιδημιολογίας, προεδρεύοντος εν το της Οδοντιατρικής Τμήματι Νικολάου Γάμα Νικητάκη, καθηγητού της Στοματολογίας, Στέφεν Πόρτερ, αποδόγματος ομοθήμου της των επιστημών της Υγείας Σχολής, εις τους επιτίμους διδάκτορας εγκρίνομεν, Αθήνηση, μηνός Νοεμβρίου 1η, έτους τετάρτου και 20ου και δυσχιλιοστού από Χριστού γεννήσεως, ο πρίτανης Γεράσιμους Δέλτα Σιάσος, η κοσμήτορ Παγώνα Δέλτα Λάγιο, ο πρόεδρος του Τμήματος Οδοντιατρικής Νικόλαος Γάμα Νικητάκης. Ευχαριστώ πολύ. Thank you very much. Professor, that was the official
Περιένδυση
ceremony.
του τιμωμένου με την τύβαινο της σχολής από τον Αντιπρίτανη του Εθνικού και Καποδιστριακού Πανεπιστημίου Αθηνών, καθηγητή Ευστάθιο Ευσταθόπουλο. Θα ακολουθήσει η ομιλία του τιμόμενου καθηγητή, κ. Στέφεν Πόρτερ, με τίτλο «Why Oral Medicine Matters in Greece and Around the Globe».
That's fine. Vice Rectors, Dean, faculty, ladies and gentlemen. First of all, I would like to thank the university for this really quite unique award. It means a great deal to me, and it means a great deal to me both academically and clearly personally. When I was a child in Scotland, I had a map on my wall. It showed the world. And round the map were pictures of different parts of the world. And one included the Parthenon. And as a child of 6 or 7, I never imagined I would visit such places. I never imagined that I would visit such places as I do now. As a child, I never imagined that I would marry someone from Greece, that I would have a mother-in-law who is Greek, that I would come home to a nice middle-class house in England and be provided with endless amounts of Greek food. The world is ever-changing. And there is actually a commonality between where I come from, Scotland, and here, Greece. We have the same saint. We have St. Andrew. We have a similar flag. The Greek is lines of blue and white. The Scottish flag is a cross of whites against a background of blue. We have this commonality. We clearly have differences. You have the sun. We have the rain. You have good football. Scotland does not. So this really does mean a great deal to me, both, as I said, from an academic perspective and also from a personal perspective. But there are commonalities across all populations, not just between Greece and Scotland, but anywhere one cares to mention, because throughout the world there are people who have poor oral health, and poor oral health impacts greatly upon their enjoyment of life, their duration of life, and their quality of life. And oral medicine is there to lessen some of that burden. And what this short talk is going to do, one hopes, is to describe what oral medicine is, why it matters, where it's going, and importantly, what does it matter for Greece itself. So this is my outline. I'm an academic. I do things in a very academically type way. I'm very logical. So I have an aim and I have an objective, although you don't get any continued professional development points because of this. If we start, first of all, with what is oral medicine, because some of you may not know what it is. And this definition that I put on the top here is kind of my version, which is a non-surgical management of disorders that affect the lining of the mouth, the salivary glands, and the sensation and movement of the mouth. That's the one I use. That's the one that tends to be used in the United Kingdom. And we deal with a host of problems, ranging from lumps and bumps in the lining of the mouth through to ulcers, which cover a vast array of different pathological types, as I'll show. In Greece, oral medicine practice is slightly different to that of the UK. Very few people in Greece purely do what we do in the UK, or I do. But they also do histopathology, something I don't do. So there's a slight variation there. If you go to America, oral medicine is separate from facial pain. And if you go to other parts of the world, it's combined with the likes of maxillofacial surgery, oral surgery, or perhaps even periodontology of the gums, etc. But in general, oral medicine is there to not do surgery on bits of the mouth that hurt, but not the teeth. So we're very selective in what we do. But why do we do it? And we do it because abnormalities of the lining of the mouth, the gums, the salivary glands, give rise to problems or symptoms that the patient encounters and may greatly compromise their living. Pain is perhaps the most common symptom. And pain in the mouth makes it difficult to speak. It makes it difficult to swallow. If one cannot speak, one cannot communicate. If one cannot swallow, the nutritional status gets compromised. So pain, resolving it, is important. Dryness of the mouth, you might think, well, it's irrelevant to life. It is not. It is an increasing problem, particularly in middle to late age people. If we do not have saliva, we cannot speak because we've lost lubrication. We cannot swallow, dry foods in particular, and we cannot taste. If you cannot taste food, your enjoyment of food diminishes. In the age of COVID, the first two variants, Delta and Omega, were characterized by taste abnormalities. And these abnormalities led to people not being able to eat properly. This then actually did impact upon their general well-being. They got over the chest problems, but they continued to have taste disturbances, which greatly impacted upon their enjoyment of life. Abnormal shape of the face is a problem associated with the lips. I'll show you some examples, but by and large, enlarged lips, particularly in young people, greatly affects their confidence. They get bullied, etc. And if one can resolve that, it greatly helps with their enjoyment of life, with dating, with finding a partner. And lastly, you've got things like oral malodor. Bad breath is its name. Most bad breath is simply caused by waking up in the morning. You all get it. I get it. But persistent bad breath, which usually comes from gum disease, but sometimes it comes from something quite unusual, and I've got to figure out what it is. And lastly, taste abnormalities. Well, I've addressed that in many ways. If you cannot taste food, if you cannot taste your Greek salad in the way that you wish, you start not eating your Greek salad and move on to something else. You therefore find that meals are a bit boring. So there's a series of symptoms that people encounter which will greatly affect their quality of life, and it's my job, and those who specialize in oral medicine, to find out why and to make it better. But this is a rather busy slide, but we'll just go through a few things. Things are always changing. Disease is becoming ever more diverse, and by and large, it's because of changes in politics and economics a lot of the time. We have changes in infection patterns throughout the world. Because of migration caused by political unrest, people bring infections to new communities that previously didn't have them. The best example of that is tuberculosis. We have the influence of the internet. People believe that if they go to the internet, they can find anything that's wrong with them, but they can't. And that causes confusion. It causes them to fail to go for appropriate care. And it sometimes makes them do very strange things. There's even a disorder termed Munchen by internet. This is where people are deliberately trying to injure themselves so that they get medical care. And that injury may include the mouth. And they get advice on how to injure themselves from the internet. We have changes in socioeconomics across the globe. They're ever changing. and that greatly impacts upon people's ability to seek and to secure health care. If people cannot seek such care, their disease will be worse. The disease will be more difficult to treat than normal, and it may kill them. These are realities that one faces. They are faced both in Greece, London, England, and across the globe. Lifestyle is ever changing, particularly smoking. For example, tobacco smoking, even in Greece, is falling. But there are lots of new recreational drugs around which impact upon people's well-being and their oral health. In London, one of the key ones that's popped up is nitrous oxide. Nitrous oxide reduces vitamin B12 levels. Without vitamin B12, well, the patients start to get all sorts of sensation abnormalities, but they start to get profound mouth ulcers, and you have to look out for it. Cocaine greatly affects the mouth if people use it on the gums, as some sports people used to. It destroys the gums. But we also have to deal with the fact that medicine is better than ever before, but there are downstream effects of that. Children who would have died in the past now survive because they receive appropriate care. But that care comes with problems that may relate to the mouth. For example, graft versus host disease, which shuts the salivary glands down and causes mouth ulcers. In recent times, there's been the emergence of drugs which are used for cancer care called immune checkpoint inhibitors. And they can cause explosions of inflammation in salivary glands and the lining of the mouth. And we have new diseases appearing every now and again, and there's one or two popped up recently. So there are many changes taking place, some in society, some economic, some lifestyle, some a reflection of medical care, each of which impacts upon oral medicine care, upon oral health and general well-being. This slide's far too busy. It's just to demonstrate that oral medicine differs from most of the other specialties allied to the mouth in that we deal with a vast array of different pathological mechanisms. That makes life a bit tough because you have to always think of new solutions to the problems, and that can be remarkably challenging. In bold, however, I've put where I know that researchers here in Greece have made a significant difference. For example, back in the 70s and throughout up to now, you do really good work allied to autoimmune disease, disorders where the body attacks itself. In the mouth, it attacks the glue that holds the lining together, and it falls off. But in Greece, you were probably the first to demonstrate the impact of this upon the mouth. You do a vast array of studies linked to Sjogren's syndrome. For example, it's from work from this university that I quote that 1 in 20 people with Sjogren's syndrome are likely to get a lymphoma. It's rock-solid evidence that's come from here, which I can use day to day to advise my patients. To advise them that if they get a funny swelling in the neck and it lasts more than 2 weeks, then I want to see them, because I'm going to then be chasing a lymphoma, a malignancy. And you do a vast array of work in relation to cancer, or primary malignancy as it's called. So this slide here is far too busy. It just basically says there are lots of ways that can damage the mouth, which are relevant to oral medicine. And some of those ways, you, from Greece, have made important findings, which I use in everyday work with complex patients in London. The oral medicine, like all fields of medicine and dentistry, is ever-changing as regards how do we make people better, how do we investigate them. And we now have a vast array of ways of investigating patients. Radiology in particular I mention. I mention it because I talked about economics, and one vice-rector is an economist. I'm now going to mention radiology because the other vice-rector here did medical physics, and therefore he's into radiology. But radiology has made a significant impact to my world in oral medicine. I can get investigations done now that I never thought possible. I can get PET CT undertaken to establish where is the cancer if it's not in the mouth. Where is the inflammation of IgG4 disease if it's not in the salivary glands? This wasn't possible until the last decade or so. The number of investigations that can be done through blood, serology, through histopathology has changed enormously. I can now get a specimen checked to see, is the virus that's commonly linked to mouth cancer in this specimen? If it is, it's actually good news for the patient. It tells me their prognosis will be better than someone who got the cancer due to smoking. We have improved therapeutics. We have drugs now which greatly change the disease. It melts it away. For example, rituximab is a monoclonal antibody which basically resolves some of these autoimmune diseases which are making the mouth fall apart. And there's a variety of other drugs out there that now do this. However, these all come with a price. The price is cost. It's all very well to do these investigations, but they are very expensive. The equipment to do these is expensive. The training of the clinicians who are going to do the tests is expensive, but they do reap remarkable rewards. Patients get better. Patients return to employment, and that makes a difference to their life. And also, they just feel better. They enjoy life in a way that was not previously possible. The oral medicine must continue to advance. One cannot sit back. And therefore, this slide here summarizes 3 areas where it must continue to advance. Again, there's probably too many facts. But certainly education and training, something that this university and also clearly Thessaloniki does well. It needs to continue to do well and indeed do better. Because you have to ensure that those people who are delivering the knowledge are well trained, are knowledgeable, etc. They're not making it up as they go along. Those days have long gone in Greece, in London, throughout the globe. We need to teach in a better way. We need to use platforms which allow ease of teaching, distance teaching. There's no reason why I cannot teach a group of students in Greece. I can just do it by the internet. I give lectures now to different parts of the world. They don't have my skills in that part of the world, and yet I'm able to do it. We need to teach clinicians to communicate better. The days of the past where you said to a patient, there's a little growth, it needs removed, have gone. We now need to find ways to, in an empathetic way, tell the patient what's wrong, what's going to happen, and what is the outcome likely to be. So teaching needs to be top-notch and needs to also include communication. Research needs to research the problems that matter. Problems that are minor, which allow a convenient paper to be published, shouldn't be done. It's wasting resources all the time. Questions that need to be asked need to be relevant for the present community and have attraction to make an impact further down the line. That means we all have to collaborate more. I heard today you have a group of patients who are getting who've got a particular disorder. I'm thinking, that's interesting, because I don't. I've got a few. Well, perhaps putting the 2 groups together, we can solve a question which is in my mind. So research needs to ask questions that are relevant. Researchers and those who advocate for the researchers need to tell those who provide the money that oral disease matters and that research funding should go to oral disease. But clinical delivery, lastly, must take account of the genuine needs of patients. It really isn't what the clinician thinks best, it is what the patient believes is best that counts. There are times when I see patients where they have ulcers in the mouth, craters that must look very painful, and I want to give them all sorts of medicines to make it better. But they don't want that because they say, it's not bothering me. One needs to have an agreement with the patient. What do they particularly wish as regards treatment? But clearly, with regard to clinical research, you need to have leaders who are well informed, but more importantly, or as importantly, good advocates. They need to advocate to government bodies, to those who make decisions, that oral health matters. It is terribly important. So oral medicine means a lot to many people. Clearly, it meant a lot to me because I've been doing it for quite a while. But how does Greece stand up here? Okay, because we now need to look at the notion, is Greece good or not? And Greece, from my point of view, is really very good. I'm not just saying it because you've now awarded me. It really is true. Now, clearly, I was trying to find some link between oral medicine and ancient Greece, but I couldn't find anything. I searched, okay? And I just couldn't find anything that really tied it up really well. I found site links. But clearly, Greece is famous as regards being the group, the country that really first described medical problems well. And it did that because people looked, people wrote, and they were recorded. That started off the process. So from the very beginning, from ancient times of Greece, people were on the lookout for health care, and that already was making a difference. Your education is very good. You've already heard that one of the schools is in the top 100, etc. And the education is clearly good because I see it firsthand. We have postgraduates coming to our institute from across the globe. One knows that those coming from Greece will be good. They'll be fine. They will be knowledgeable. They might cause a bit of trouble because they disagree, but that's the way it goes. But the education clearly is good. You have 2 dental schools. Both of the deans, by chance, do oral medicine. As you can see in the image I took, well, you can't see, it's too small, I took this morning. Importantly, they talk to each other. They have an agreed way forward, and that actually is very important with regard to education. If you have educational institutes in conflict, you cannot get change made at a national level. So it makes a significant difference. And because they both do oral medicine, one assumes they're going to push oral medicine more than other subjects, although I wouldn't like to say that, but I shouldn't be saying that. Your research is good. I've already alluded to that. You research in subjects allied to oral medicine is good. I've mentioned that with regard to rheumatology. I particularly like the papers that come from Athens as regards that. Your knowledge transfer is exceptionally good. You have authors here who are world-renowned, who've published atlases which you go to centres throughout the globe and they're going to be there. And I've shown you 2 examples. One of them, the author's here tonight, Dimitris Malamas. The other author is George Laskaris. George Laskaris is renowned across the globe for writing his atlases. And there are other people. Alexandra Sclavoulou, who previously was in Athens, she likewise writes very good atlases. So your knowledge transfer is, in my estimation, exceptional. Your clinical delivery is high quality. One can see that from the cases that people present at meetings. And lastly, your advocacy. Something I am particularly keen upon is good. You represent your specialties, your country well. Nikos has been the president of EAOM. Demetrios, Thanasis, Nikos and others have had central roles in other groups allied to changing the course of oral medicine. These are important things. A striking thing one finds about people who wish to advocate is they like the role, the title, but they don't actually do the work. These individuals, and others like them from Greece, do the work. They get their hands dirty. They go and make change, and that is really very important. So Greece makes a mark in oral medicine, without a doubt. But Icarus went too close to the sun. You cannot take your eye off the ball, because things are going to continue to change, as I already alluded to. And this slide here just summarizes them again. And where I've got an asterisk, that involves Greece. In other words, any of the changes I previously mentioned apply also to Greece. And indeed, you have some unique ones. You have the migration issue of the people coming up from the south. They then migrate across and eventually come across to England. So we have the echo as regards that. You have the same internet problems that we have the same recreational drug problems that we have, etc., etc. So there's much to do in the future as regards this. In other words, the younger generations have much to do to help the older generations. And this is important both from the point of view of the individual, the family, the population. One wants to make people better, to enjoy life, and to make economies better. And with good health, that is achievable. So my aim tonight was to do as I've said, to really give an overview of the role and challenges, and I hope I've conveyed that to you. But before I finish, I wish to thank you. I first of all wish to thank Nikos, your dean, for proposing me for this award. It's remarkably kind, so thank you. I wish to thank the two vice-rectors for their kindness again. They were very polite to me last night. They made fun of the fact that I don't speak Greek, but they were very kind and very nice. They were forgiving of me. In my family, by the way, I have a wife who's Greek and speaks fluent Greek. I have 3 daughters. 2 of them speak fluent Greek. The third one, the small one, refuses to speak Greek, but she can speak Greek. I'm faced with a situation that the only person who will communicate with me, not in Greek, is the dog. The dog just barks. But Greece made a great difference to me as regards my personal life. And the warmth that Nikos, that the 2 vice-rectors shown to me, just reflects your kindness that you all have. I want to thank Maria. Now, Nikos is the dean. He's the front man. Maria did all the work. She's done all the running around, etc. And so I really want to thank her enormously for that. And I want to thank the staff of oral medicine and oral pathology here in Athens, because each of them were very patient with me and very kind. And kindness and friendship and warmth means a lot, whether one is an academic, one is a father, or one is just a Scottish person. And so thank you very much as regards that. So on behalf of myself, I would like to thank each of you for being here. I would like to thank the university for this award. And I sincerely hope that you have enjoyed this talk. Thank you.
Πέρας της εκδηλώσεως, σας ευχαριστούμε πολύ για τη συμμετοχή σας.